So firstly is introduction. Argon is a gas that around us literally. It's made up of the air we breathe, even we don't see or notice it. Argon is completely invisible, has no smell and does not react much, which make it kind of like the quiet and lead members of the gas family. Because of the calm and stable, argon is super useful in industries like welding, manufacturing, and even electronic. It helps create safe and controlled environment by keeping out other reactive gas like oxygen. But just because argon keeps to itself, it doesn't mean it's harmless. When used in large amount or in closed space, it can silently push out the oxygen that people need to breathe. So, even it's useful and helpful gas in the right setting, it also needs to be treated with respect care.
Next, I'm gonna discuss about the harmful effects of argon. Argon is an inert gases displaces the regular air, causing the partial pressure of inert gases to rise at the expenses of other gases. This process is enhanced if the gas density is higher than air as with argon. The result is hypothermic hypoxia, meaning low oxygen in the blood and subsequently low oxygen in the tissues. Hypothermic hypoxia leads to an insufficient amount of oxygen in the air being breathed and consequently in the blood. Hypothermic hypoxia from inert gases is a risk in work-related accidents involving industrial gases, especially when they are used in small, insufficiently ventilated spaces. Next is lack of signage. It's an important danger associated with inert gases or chemical. This absence of alarming symptoms makes hypothermic from inert gases an easy to miss cause of serious incidents like cardiac arrest. Last but not least, severe organ damage. Prolonged hypothermic hypoxia leads to severe irreversible damage to vital organs, particularly the brain. The combination of the hypoxia, delayed adequate oxygenation, and extended CPR can cause irreversible damage.
Hi and Assalamualaikum. So, the scenario that I found in the article is during a routine welding job inside a sealed metal tank. A welder is using argon gas as a shielding agent. The area has no ventilation and no oxygen detector installed. Over time, the argon displaces oxygen in the tank. So the welder begins to feel lightheaded and confused but ignores the signs. Minutes later, he collapsed due to oxygen deprivation. A co-worker enters to check. Also feel dizzy. Emergency services are called but both are unconscious when help arrives. So, in this real-life inspired role-playing, we are showing how argon gas, through non-toxic invisible, can be deadly in confined spaces. The welder is working inside a tank filled with argon for welding. Since argon are heavier than air, it sinks and slowly displaces oxygen. So, the body doesn't recognize low oxygen levels immediately because argon has no smell or taste. The welder feels dizzy and disoriented, classic early symptoms of hypoxia. He collapses before realizing what's happening. A second person enters without protection and starts experiencing the same symptoms. This situation is a classic case of asphyxiation due to oxygen displacement. It's a key hazard in industrial hygiene. This situation is a classic case of asphyxiation due to oxygen displacement. It's a key hazard in industrial hygiene. The takeaway is even gases that aren't toxic can still kill, if it's not by poisoning but by removing breathable air. That's why we must use oxygen detectors, ventilation systems, and follow confined space safety protocols in a workplace that uses gas like argon. That's all.
So the next one is hazardous effect of the dangerous argon. They are separate in two situations, which is in industrial and non-industrial. So firstly, we will talk about in industrial. The first one, asphyxiation by oxygen displacement. So what happened that can affect asphyxiation? In manufacturing environment where argon is used for welding, metal treatment or inerting system, it can displace breathable air. Due to its higher density than air, it sinks and replaces oxygen at ground level or in confined space like tanks or pits. Why argon is dangerous? So, first one is it can reduce oxygen concentration without warning. Below than 19.5% oxygen, brain function begins to decline. The lastly is the workers who are exposed may suddenly collapse without feeling anything beforehand. So the next one is hazard effect. Argon can cause silent suffocation. It doesn't harm by itself, but it eliminates the air that you need to survive. So the second one is frostbite and cold burns from liquid argon. So what happens that can get frostbite and cold burns? In many industrial processes, argon is stored in use in liquid form at ultra low temperature, which is at -186 degrees Celsius. Workers may handle it during transfer, storage or cooling operation. So why argon is dangerous? So firstly is liquid argon can instantly freeze human tissue. Second, accidental contact cause frostbite, blister or even permanent damage. Lastly, it's also cause metal parts to become brittle and crack, which can lead to equipment failure or dangerous leaks. Lastly, hazard effect. Severe cold burns, loss of body part, eye damage, and mechanical risk to surrounding infrastructure. So the last one is pressure hazard from rapid gas expansion. What happens that can get the pressure hazard from rapid gas expansion? As liquid argon warm, it rapidly turns into gas. 1 liter of liquid becomes 840 liters of gas. If trapped inside a sealed tank or line without venting, the pressure builds quickly. Why argon is dangerous? This can lead to explosion or ruptured containers. Next one, rapid gas release may blow open pipes or tanks. It also can damage nearby equipment and injure workers with debris. Lastly, hazard effect. Argon's pace of changes from liquid to gas create pressure surges that can rupture vessel or trigger explosion. So the next one is non-industrial. Firstly, hazard in medical environment. So what happened in medical environment? Argon is used in certain surgeries. It may also be part of mixed breathing gas or used in closed system surgical tools. Why argon is dangerous? Firstly, gas may leak into closed room. Medical staff and patient can suffer oxygen deficiency. Lastly is improper mixture in breathing system can cause accidental suffocation. Hazard effect. An intense exposure in closed room, low oxygen during procedures, or improper gas mix in life support system. So the second one is hazard in small enclosed building. So what happened in small enclosed building? If argon leaks in place like basement, cold storage room, electrical closet, or enclosed workshop, it can fill the room silently. Why argon is dangerous? Argon sinks to the floor, displacing oxygen without being seen or smelled. Next, any person entering may begin suffocating without realizing it. Lastly, hazard effect. In unexpected places, argon can create deadly condition, especially for people who don't expect any gas exposure risk. So lastly is hazard in laboratories and university. What happened in laboratories and university? Argon is used in glove boxes, reaction vessel, and cooling bath in research and teaching lab. In small, poorly ventilated room, leaks can displace oxygen. Why argon is dangerous? Maybe unaware of gas behavior, can burn unprotected skin, or leak in a closed lab can go unnoticed for hours. Lastly, hazard effects. Sudden oxygen loss, frostbite injuries, and poor emergency awareness in educational setting.
So, here are the discussion that I found. First of all, argon is a gas that has no color, smell, or taste. So, people don't notice when it's in the air. Although it's not poisonous, it can be very dangerous if it replaces the oxygen we need to breathe, especially in small or poorly ventilated spaces. Because argon is heavier than air, it can build up in low areas, such as push oxygen out. This can cause a person to pass out or even a lack of oxygen without any warning signs like coughing or choking. That's what makes argon so risky. It's hard to detect and act silently. In this case, a problem with welding equipment caused a large release of argon in a small space. The patient suffered from severe oxygen shortage, which led to brain damage and death. This shows how important it is to have good ventilation and to use oxygen monitors when working with gases like argon. Simple safety steps could help prevent tragedies like this.
The conclusion is, argon is a dangerous inert gas that can cause fatal asphyxiation by displacing oxygen. It is colorless, tasteless, and odorless, making it difficult to detect. Hypoxia from argon can cause symptoms like fatigue, confusion, dizziness, and rapid fainting, often without triggering respiratory alarm signals. Severe hypoxia leads to swift, irreversible organ damage, especially to the brain, which may not be preventable even with extensive resuscitation. Work-related incidents involving inert gases like argon are rare, but potentially lethal. Reliable and portable oxygen meters are crucial preventive measures to avoid such tragic incidents.